much, Dr. Humphrey. It is great to see that climate change is in fact being embedded into every aspect of the medical curriculum at Harvard. And so now it is time to look more closely at the health systems responsible for communities around the world, and particularly those providing services to the most vulnerable populations. Universal health coverage means that all people have access to the full range of quality health services that they need, when and where they need them, without financial hardship. But what about the kinds of new hardships that we've been hearing about arising from the effects of climate change? How can we ensure that we do continue to expand health services for all, even in the face of adversity? And so to help us answer that question, I'd like to introduce our next moderator, who will be leading a panel of experts who can elaborate on what we mean by climate-resilient health systems. To lead a discussion amongst a distinguished set of experts is Dr. Nino Kharaishvili. Nino is a global expert in health security and health system emergency preparedness and resilience, serving in the role of Global Solutions Director for Jacobs. Ladies and gentlemen, please welcome Nino to the stage.
Hello, everyone. As I welcome my panelists, please bear with us. We'll do a quick introductions. Ooh. Very bright. Well, good afternoon, everyone, and welcome to the session where we explore the climate resilience in public health systems and sort of talk about what are the essential building blocks to build that resilience in the healthcare systems around the world. As MC already talked about, my name is Nino Kharaishvili, and my background is global health, biodefense, health system strengthening, and I'm currently serving as a director at Jacobs. I also have a distinct pleasure to be here with a very distinguished panel members, and I will introduce them in due time. But before we dive in, I want to give you the definition of resilient health systems, because we talked about in the morning resilience, resilient health systems, but I think that we all need to sort of have a common definition what we mean by that. So just to read out loud, resilience is defined as a capacity of a system to absorb, adapt, anticipate, and transform when exposed to external threats and still retain control over its remit and pursuit of its primary objectives and functions. Well, it is mouthful, isn't it? Well, that's why we are here, to try to break it down into more manageable pieces. And just to promote a dialogue, I would like to put a slide up on the screen, if you don't mind. And this is a resilience model that we've created at my company, because we are trying to use this with all healthcare systems that we are working. And this particular model incorporates the World Health Organization's recommendation, and I know, Mazen, you will talk about that quite a lot. We also have Canadian model going into this framework, as well as some of the recommendations from public health schools and entities around the world. And we use this approach and work because we think that it's a simplified way of showing the essential building blocks and core competencies. And as you can see, it starts with policy and frameworks as a competency one. It goes to the healthcare infrastructure, goes to the logistics, goes to the data analysis, and a training of the healthcare workforce. And it's tried to show the simple approach, but as you can imagine, behind this one simple slide, there's a lot of different schools of thoughts that come together. We will hear about the frameworks, as I said, but how do we overlay this approach, resilience, in the climate context? Let me do some scene setting for you. We saw that COVID-19 caused a major disruption over the last 3 years, not only in healthcare, but also around the world. We saw the disruption in economy, disruption in mobility. We saw the changes in the lifestyle. And now it's time to talk about how climate change will be, or is, the next public health threat. And just to be simple, climate change is a public health threat in two ways. It's very easy. One, we already heard that it directly affects the human health and increases patient flow to the healthcare facilities, which then causes a surge and overflow of patients in the healthcare settings. That's never good. Second, the climate-related changes like extreme weather events can cause a disruption to healthcare facilities or healthcare operations, and that in and itself also is a huge challenge in the healthcare setting. Paradoxically, healthcare sector is one of the major contributors to greenhouse gas emission around the world. But this is not a part of our conversation, so I'll save it for the later. And just to sum up, and based on the COVID-19 case, we've learned that preparation and prevention are essential to avoid major disruptions. We definitely need to avoid the major disruption because I don't know about you, but I really don't want to relive the last 3 years of fear and isolation. So I'm very excited to welcome my panel members, and I would like to introduce them, and then we will dive into the question. First, right next to me sits Dr. Mazen Al-Malkawi. He's a regional advisor for climate and environment at the World Health Organization. Then we have Dr. Montira Pngsiri, sorry about that, senior advisor for climate and health, Save the Children. And the last but not least, Dr. Ahmed Elsayed, executive director at Abdul Latif Jameel Poverty Action Lab in the Middle East and North Africa. Welcome. Well, let me start with the first question. Mazen, if you don't mind, I will start with you. And if you don't mind also, maybe, do you need your slides right now or later? So I know that you're representing the World Health Organization on this panel, and I would like to maybe give you a stage to talk about what are the latest activities from WHO to fight climate change. And would you please describe or help us understand how do we operationalize those frameworks?
Thanks a lot. I'm coming from the Eastern Mediterranean region, but representing the globe at the moment. And if you are aware, in COP26, we launched what we call the COP26 health program, which was calling upon countries of the world to commit to updating their health systems into a climate change resilient and sustainable health system. And in response to that call, at that time, 60 countries committed, including 12 from our own region. And I'm very happy to share with you that Lebanon just joined the club, and now we have 65 countries who are committed to update their health systems into climate resilient and sustainable ones. And I will talk what do we mean by this. And at the same time, I'm back to the question that was raised by our colleague from the World Bank, to lower the carbon footprint of the health system and to minimize the bad health impacts that the health system might cause in different parts of the world. Next slide, please. I will not repeat the definition of the climate resilient health system because Nino already mentioned it, but something that we faced while talking to the health systems people, you know, they don't like much the word climate resilient health system because to them it's only one resilient health system. But inside that health resilient system, it should take care for climate change, for emergencies, and for the other things. So it's good to use the right terminology while approaching the different audiences. In WHO, we consider that the health system is consisting from 6 main blocks: the leadership and governance block, the health workforce, the health information systems, the medical products and technologies, and the service delivery, which is cross-cutting with other providers of services that are related to health, and the most important part, which is financing, how we are going to finance the health systems and the climate change adaptation and mitigation measures. Part of it is the healthcare facilities. You know, it's the health system as a whole is consisting from different activities, including the healthcare facilities. And what we are calling on that the healthcare facilities need to be resilient as well as sustainable. In some of the countries, they prefer to call it green facilities, for instance. What do we mean by this? The health workforce within the healthcare facility, if they are aware of my previous speaker was talking about the education of the workforce, the energy that is being used in the healthcare facility, the infrastructure technologies and products, and as well the waste management or the water sanitation and hygiene within the healthcare facilities. If you allow me to talk about some examples of products that we would like to see in the health systems in the blocks. For instance, take the leadership role. We've noticed that there is no defined climate change and health focal point in the countries, and this is something very important and needs to be identified. Why? Because if you see the NDCs coming from the different parts of the world, rarely you have the World Health in the NDC. Because this is what is lacking, that we do have a discussion within the health sector. The environmental people, they have a discussion as part of the NDC, but we rarely talk with each other. We rarely contribute to the work of each other. And having a climate change focal point at the country level that is part of the NDC work in the country will make sure that whatever adaptation and mitigation measures will be part of the national NAP or HNAP at the country level. If we go to the second health which is the health workforce, we need to make sure, and I think the previous speaker talked a lot about this, is to make sure that the curricula of the different health professions is really geared, towards understanding the climate change and its implications. And also, we need to have some specific training for the workforce on some of what we call them the climate sensitive diseases. Dengue fever is coming to different parts of the region. I'm sure that the health workforce in some of those countries are not aware of what is dengue fever, what are sort of medications that are needed, what equipment, and part of the health workforce improvement within the health system is to make sure that they are properly educated and trained. Also an important block is the health information system. We need to have in place what we call the vulnerability and adaptation assessment. We need to understand, and that's a country sort of driven process, how the different climate change things will affect the health, what we are expecting in the coming 20 or 30 years. Are we expecting new diseases? Are we expecting redistribution of vectors that are communicating diseases? This cannot be done unless you have a formal V&A assessment where you try to put the climate change forecast and try to, based on the available data and the expert opinion, what we are expecting in that country. And according to that, you will prepare an early warning system. It's too late when you start counting the disease. You need to have an early warning system. For instance, you put an early warning system on mosquito rather than on disease, so as to avoid, the disease coming to the country, and then whatever action you take will be late. And also, we need to update the research agenda in order to reflect the needs of the countries. If we talk about the sustainable technologies and infrastructure block, we've seen, sadly, that some of the hospitals were drawn with the floods caused by climate change. I think in Pakistan, in Oman, and other parts of the world. And that would be really, you are putting the whole preparedness in the healthcare facility, and suddenly the healthcare facility is drawn. Then you are jeopardizing the whole health system by not being prepared, for the consequences of climate change. Renewable energy is a very, very important player, and I think we need to promote the use of renewable energy in healthcare facilities. Proudly, I say it, in WHO, we demonstrated an off-grid solar system in one of the hospitals of Somalia, and that's a total reliance on clean energy. It supports the health care facilities and at the same time minimizes the carbon footprint of the health system. Another important block of the health system is the service delivery, managing the environmental determinants of health. You know, the 24% of the disease globally is caused by factors that are not under the control of the Ministry of Health. We cannot control the drinking water that we drink or the air that we are breathing, but what we can advocate for action by the relevant sectors, and this is usually an important role that the Ministry of Health should play, but it is increasingly needed during as part of the climate preparedness. And the final block of the health system is the financing. We know that a lot of financing tools are available, but sadly, and I think we heard it in the morning, that only 2% of the funds goes to the health sector. Why is this? Because unfortunately there is no dialogue at the national level. The health professionals are not part of the negotiation. The health system needs to understand how the Green Climate Fund or the Global Environment Facility is working. I hope that was not a too long answer.
No, wonderful. Well, thank you so much, Mazen. And I will come back to you with taking that leadership and data components. I will be curious to see how we can overlay that context and talk about the collaboration, what needs to be done for those components, the 6 components that you talked about. But I want to go with the next question to Montira. Montira, you and I talked about this, and we've heard pretty loudly also from the Lancet Countdown report that the global communities that are already disadvantaged are disproportionately affected by climate change. And I know that you're working on the intersection of climate, health, and equity together. So my question to you would be, can you give us a little bit of the overview of your work and the Save the Children's approach to addressing climate, health, equity, climate, health, and equity together?
Thank you, Nina. And really, it's a great privilege to be here. Thanks to the meeting organizers. It's a real honor to learn from all of you. Climate change increases inequities in the present and for future generations. For Save the Children, climate and health is a climate, health, and equity challenge. So having defined it that way, we're taking a systems-based, multi-sectoral approach to climate, health, and equity. As you heard from Dr. Mazen, many determinants of health fall outside of the health sector. So we have to address the health and climate challenge holistically, using a systems-based approach that considers the many factors and interactions that contribute to or are affected by climate change. So taking a systems-based approach can help us see the differences between the root causes and symptoms. And in doing that, can help us identify intervention points to stimulate positive change while minimizing the potential for adverse consequences. So there are many objectives to our work. First, we have to do more than reduce risks to health. We have to sustain health, recognizing that health depends on the state of our natural systems, like our climate. Second, we have to support multi-sectoral governance because the nature of the climate and health challenge requires it. And we have to support governance that's inclusive of community engagement. Engagement that is so critical to strengthening health systems with their capacity to respond to climate hazards. And we want to support communities to prioritize their climate risks impacting their health. Also, we want to support the development of national and subnational plans that reflect an understanding of climate and health relationships. And through all this, to elevate the voices of children and other underprivileged groups like women in policy and advocacy discussions at local, regional, national, and global levels. So how do we get there? Next slide, please. There are 5 key barriers to addressing climate, health, and equity together. So our organizational strategy and programming is focused on overcoming these barriers. To overcome limited awareness that there are common drivers of climate and health, we're improving understanding of the multisectoral impacts of and interconnections between human activities, climate, and health, and the social determinants which contribute to it. To overcome inadequate recognition of the co-benefits of action on climate and health, we're supporting community actions to identify and take action with climate and health co-benefits. To overcome decision-making silos or siloed interventions, we're supporting multisectoral governance through the use of integrated data and decision support tools that can facilitate information sharing and policy coordination across relevant sectors and ministries. So when I say integrated, I mean what Martin and Felipe referenced early this morning. It's the linkage of climate data, health data, and social determinants that affect it. To overcome the limited participation of communities, we're strengthening skills and leadership capacity for them to engage in the co-design and implementation of actions. And then to overcome inadequate resources, we're developing multiple benefits-based advocacy to engage the public and private sectors to increase finance. Let me end with one example of an activity we're undertaking now that is focused on the community level. In Somalia, Vietnam, and Colombia, we're developing community-based systems maps of climate, health, and equity interconnections, and use that understanding, the maps, to identify priority actions. This could be a model for active community engagement, which shows the value of an inclusive participatory process for supporting communities to co-design and to co-implement actions for sustained impact. So I'll yield there. Thanks, Nina.
Thank you, Montira. I appreciate you breaking down some of the components of your approach. Ahmed, I want to come to you. There was a lot of conversation in the morning, and even our conversation here is mentioning a lot of data, right? Using scientific data to inform different decisions. And I know that your organization works on gathering data and evidence to inform the policy decisions. So I would be curious maybe in our audience to tell us a little bit, what is your approach, JPAL's approach, to ensure that policy is informed with all data that you are collecting? And how is that impacting policy outreach, training? And I know you're also working on various sectors, on climate in various sectors. And is there or are there any lessons learned that can be shareable or transferable to the health industry?
Sure. Thank you so much, Nino. This is like a very interesting question. Let me go one step back and define what JPAL is. So JPAL is Abdul Latif Jameel Poverty Action Lab, which is a global research center that's based at MIT with 7 regional offices. And each of these offices is hosted by a local university somewhere in the world. And I'm honored to be the executive director of JPAL MENA, which is hosted at the American University in Cairo. So I'm also an associate professor at the university there. The idea behind JPAL is, like the mission is to reduce poverty by ensuring that policy is informed by rigorous scientific evidence. Mm-hmm. And to do this, we run randomized evaluations. So the idea is to evaluate the impact of different policies and programs that aim at reducing poverty using this technique. And we have been doing this actually over the last 20 years. So this year is marking 20 years of the life of JPAL. We started 2003. Our funders, Esther Duflo, Abhijit Banerjee, and the lifelong affiliated Professor Michael Kramer, who's going to talk on this conference. They were jointly awarded the Nobel Prize in 2019 for using this randomized evaluation technique as an innovative method to inform policymakers and also improve research towards reducing poverty. As you mentioned, we work across different sectors. Anything that relates to poverty is something that we are working on. And of course, environment and climate change is imposing itself as one of the most imminent threats that we are encountering right now. And its impact is disproportionate because it affects the poor more than the rich across advanced and developing countries alike, right? That's why actually we care a lot about this topic, and it's a very important one on our agenda. So we have an initiative called KCI, King Climate Action Initiative, which pretty much tries to implement this technique across the environment and climate change type of research. And it centers around 4 main areas: mitigation, adaptation, energy access, as well as pollution reduction, right? And as you may think, of course, those are cross-cutting. So some of our interventions are pretty much kind of across the 4 or most of these items. I forgot to mention that it's not only about research, but also we work together with policymakers, mainly governments, NGOs, and different development agencies and institutions, to make sure that the evidence that we produce with these randomized evaluations end up in their hands, and hopefully actually they can scale it up or scale down actually the unsuccessful ones, the successful ones to be invested on and continued, and the less successful ones actually to be scaled down. To give you a couple of examples, so we have managed to run almost 1,600 randomized evaluations over the last 20 years across different sectors, as I mentioned. I'll give you an example or two on the area of climate change and dealing with pollution. So one of them is coming from JPAL South Asia in India, where typically we have this big challenge of cutting carbon emissions coming at the cost of affecting growth, right? Especially in developing countries, and if we're talking about encouraging developing countries to invest more in the industrial sector, which is bringing a lot of young people into the labor market, creating a lot of jobs, etc. But this has the negative impact of a lot of carbon emissions, etc. So how to deal with this? So far, the strategy across many developing countries was strict regulations about the carbon emissions, and that's it. You have to adhere to this kind of limit. But this hasn't been successful so far, and it has proven to be not that much of cost-effective strategy. So one idea is to introduce what's called a new strategy where you have kind of trading scheme for carbon emissions. So the government would be pretty much putting kind of a cap, and then you transmit permits across the different industries and factories and allow people to trade these emissions, right? So this is one strategy that has been used in the European Union and the US, but it hasn't been there in developing countries. So JPAL South Asia tested this in Gujarat, India, as a randomized evaluation. And this technique, with almost no cost, reduced carbon emissions by 24%, right?
Impressive.
So this is kind of one innovative way of telling policymakers actually what could work in this direction. And right now we are working with the government to scale this up across almost 300 factories, and this is still running. This is one example. Another example comes from the region, from the MENA region, JPAL MENA. We are working together with a couple of NGOs in the south of the country, which is the most deprived part and the poorest part of the country. In rural areas there, a big problem is finding a creative way of getting rid of the animal waste, which has negative consequences, right? People do not use it actually properly. So one technology there is the biogas digesters. Just kind of like a small unit that you attach to your farm as a farmer, or your house, or the place where you put your animals, and you feed those with the animal waste, right? And this produces kind of like a clean cooking fuel, renewable source of cooking fuel, at a small cost, but also as a side product, you get high quality fertilizers that you can use actually in your agricultural land. This technology has been around for quite some time, but it hasn't been used that much. Like the take-up rate is very small. So we try with this technique, with randomized evaluations, to test what the barriers actually are. Are they like information barriers? People might not know about this technology and its existence. So we tell them about the existence of such technology to see actually to what extent they will be adopting it. Another barrier could be like credit constraints, so like financial barriers. Those people are not able to invest in this technology, despite the fact that in 2 years' time, it pays for itself, right? So we try to alleviate this also experimentally to see to what extent this could help. This is still like running in progress, and hopefully actually we'll come up with kind of answers to those, and we bring those to the hands of policymakers so that they can make informed decisions.
Wonderful. Well, thank you for that. I have follow-up questions, but I'll say them just to keep the dialogue going, and it seems like we have a few more questions to address. Mazen, I want to come back, and you mentioned the 6 building blocks and gave us a pretty nice overview of what they are, but they are also rooted in a different parts of, I would say, our fabric, right? The social fabric. And what I mean by that, this requires a lot of collaboration to come together to get it done in the different sectors with the support of the different stakeholders. So my question is all about how do we increase the awareness, what is required to build the resilient health systems? How do we improve the collaboration, bring the governments and private sectors and others together? So if you could give us a quick answer on that.
Yeah, thanks for the question. As part of the attach and the whole issue where we called upon countries to start building their system, there was supposed to be part of the process is to announce the commitment of the government to update that system, and that announcement should have been made public, which means that to involve the community. Actually, it's a commitment different than what we are committing for the UNFCCC. It's a commitment between the government and its own public that we are going to protect your health by updating our system. Definitely the community would never understand what are the 6 blocks, but the different aspects that would be of concern to the... But the first thing is huge. Some of the countries, they did it as a press release. Some of them, they announced it. But to a certain extent, we were making sure that the public are aware of the plans of the government, in order to update the system. We started helping some of the countries to start implementation, and one of the basic steps actually is to have a multi-stakeholder body. Call it a committee, call it whatever, but at least a body that is responsible of addressing the different aspects of what we call the multi-sectorality, whether it's at the community level, whether at the government level, and the different controlling bodies and the academia. But the committee proved to be very powerful in some of the countries, where they organize a sort of hearing sessions. They listen, to the different needs, and a guidance to the countries that are going to. Don't underestimate this. This is really a difficult task. And you need to bridge the gap between or to lower the silos that are, that are really, it's a fact actually, we cannot hide it. Sometimes in order to exchange a piece of information between one ministry and the other, you need a lot of work. But part of it is raise the awareness of the goal of why we are doing this. It's for the protection of the benefits of everybody, to protect our health. And it proved working. It's not easy. It's proved working, but you need to identify based on the local circumstances how to do it at the governmental or at the national level to involve all the stakeholders, including the public.
Well, thank you. What you're highlighting there is a multi-sectoral approach is really critical, and designing that communication around the local context is really critical for the people to understand why government is taking it, whatever the steps they are taking. So, Montira, I want to actually ask an almost similar question. What does it take for multi-sectoral collaboration to happen? Because, as Mazen was mentioning, there are a lot of silos in the health and non-health spaces that we need to work together to get to the common goal. So what is your recommendation or like observation, and how do we promote multi-sectoral collaboration?
Thanks, Nino. Great question. Let me first start by saying that the key to taking that systems-based approach I talked about is the integration in this context of knowledge on climate, health, and social determinants which affect it. And it's not integration for integration's sake. It's integration into tools that can support known policy needs for vulnerability assessments, routine monitoring of changing environmental conditions and what they portend for health, the quantification of health impacts of taking climate action and the impacts of not taking action, and to do trade-off analysis. What are the implications of choosing one policy over another for health and non-health, but health-influencing sectors? So I think these kinds of tools that are based on integrated data are really critical for facilitating information sharing across sectors and ministries, and to support that all-important policy coordination so that we're not working at cross purposes. I think that is what is needed. And so we need investment in those integration methodologies to be able to serve those decision-making purposes better than we are now, and the evaluation and the utility of those decision-making tools.
Fantastic, thank you. And Ahmed, we've talked about, I wanted to follow up, you mentioned some of the innovative tools that you already used and the data that comes out of it, how that informs the policy decision and supports the collaboration. I wonder, what are your next steps, and what are the other tools or approaches that you are testing currently, and how that can be applied to the health systems, building resilient health systems?
Right. So one thing that's super important for us is working jointly with the governments, also around spreading the word about the culture of evidence use, and why it's important actually to test these questions before they make big investments. So actually we're working jointly with different government partners and different stakeholders, NGOs and different institutions, where we reach out to them and discuss with them actually the policies and the evidence that came from different contexts, so that we make sure that they are aware of the evidence that has been built out there, and this is like always a starting point actually towards thinking with them about what they have in mind, the policies they are considering, and then we take it from there, and we try to design and evaluate the impact of different policies together with them. So this is like an important thing that will remain there on our agenda, and we do our effort actually to reach out to different institutions in the MENA region that focus on this. This is extremely important. The other thing that we are considering is to expand the research. I mean, the issue is we have several challenges when it comes to climate change, and we all agree that there's no silver bullet, right? Any program or any solution would be, I mean, it's not likely that it will be win-win. Definitely, you have to make some compromises and stuff. So actually, the problems are massive in terms of their quantity and how big they are, and the resources are limited. That's why actually it's important to ensure that we test what exactly could be done there. And this could be achieved through breaking down the big complex problems into smaller ones, right? And then address each of those. And this is one of the things that actually we try to do. So the future for us will be bringing more research in the direction of air and water pollution. We are working jointly with Community Jameel on this. So the future would be hopefully coming up with kind of like, answers to important questions around the issue of pollution and other climate change issues. And hopefully, actually, we can scale things up working together with different stakeholders.
Wonderful. Well, I want to make sure that we have time for the questions, so I will try to summarize our conversation and give you time to do one last call for action or recommendation for the audience here. But just to even summarize, creating resilient health systems is not an easy task, right? We've heard the different approaches, and it is so complex that involves in the multiple sectors and the different collaborations. We've talked about the communication importance. We've talked about data usage. There are limited resources to do that. And there's just too many approaches that we need to be thinking about and making sure all the stakeholders are involved, everybody's voice is being heard. And it's a pretty complex task and undertaking. So with that said, I wanted to make sure that you have an opportunity to say, if it was the one thing that you're recommending as a takeaway point to our audience, what is your suggestion? 1 minute or less.
Yeah, I think one thing is missing from the health sector. There are some competencies that are not existing within the health system. We either have very good surgeons, we have very good public health people, but we don't have advocates. We don't have resource mobilizations officers. We don't have people who can affect policies in other sectors. This is very essential. And what we usually do, we give this assignment to somebody who is in the health sector, a physician or a nurse or a public health officer, and ask him, challenge him of doing it. It requires a lot of other competencies, make sure within the health system that you need to have extra experience in resource mobilization, in advocacy and communication.
Dedicated resources.
Yes.
Yes. Montira, what about you?
I think there's shared interest among all of us for mobilizing science for healthy people and a healthy planet. I think how we do this is really important. So my call to action would be to engage community actors and partnerships to build that shared systems-based understanding of the climate and health in context so that we can, with them, identify shared actions for sustained impact.
Wonderful, thank you.
For me, 3 points very quickly. The first one is investing more in innovative solutions, which is something that we have started and we plan to continue to work on. The second one is policy outreach and making sure that what we are doing is not separate from what the policy world is looking at, and making sure that the policy making is informed by scientific and rigorous evidence and research. And the third one, which is not last in terms of importance, but it's actually one of the most important ones, is capacity building and training and spreading the word about the use of evidence. Try to create kind of a platform for researchers and practitioners and people who are interested in these topics to understand a bit more and engage also in the evidence building process.
Fantastic, thank you. Well, in the summary, and before we open the questions for the audience questions, it seems to me that what we talked about, there is a knowledge. We know what we need to do. We know what capacities need to be developed. And basically what I'm hearing as a conclusion from you all is that we need to mobilize the resources. We need to coordinate actions. We need to invest in the solutions to move this forward, do the policy outreach, and do the capacity building. Basically, we have the approach. It's just now, how do we do it and implement and operationalize all these wonderful recommendations? That's where we are at the moment. Is that a fair assessment?
Yep.
Okay, wonderful. Well, I'm curious if we have, this is really bright. So I don't see, I see maybe hand over there. Okay, good, I see the hand.
So hi everyone, I'm Omnaya Al-Amrani. I'm the youth envoy for the COP27 President. And thank you so much for your interventions. I have two questions. The first, so last year the WHO released a report looking into the gap when it comes to research around climate change and health in the past 10 years. The regions that had the least evidence around this intersection was MENA. And now we have COP28 in UAE, COP27 was in Egypt. I'm curious to hear from the panelists, how can we utilize these opportunities in your perspective to increase the interest and the research capacity of the region? The second question is regarding policy outreach. How can we increase the uptake of the actors such as the ministries of health and other stakeholders in the policies that we develop and the evidence-based interventions so that we can really effectively bridge that implementation gap and that gap between what we develop in terms of research and solutions and in terms of what can be implemented? Thank you.
Thank you. Who wants to tackle first? Go for it.
Yeah, thanks, Omnia, for the question. We were part of that research activity in Dubai last year. And it goes without saying, unfortunately, research is lacking in these developed and developing countries. And I wanted to make this note actually during the previous session. Evidence by its nature is biased. It's biased to research and to technology. And technology and research is maintained by the developed countries, by the Europe mainly and the States and other developed countries. We've tried to measure how much research is being produced in the Middle East and North Africa, and it goes without saying, very, very little is produced. And one of the most important things, it's not lack of researchers. It's lack of information producing facilities. You know, information is an industry. You know, you need publishers. You know, I'm Mazen Al-Malkawi, I do a research about this aspect in Jordan. I don't think that the industry is much interested. They want more you know, accepted to their clientele. So what we can do, and that would be a call for COP28 and others, is to support the information production capacity of the region by adopting a journal or a database that produces and publishes information for the which taking care of the needs of the developed and least developing countries. And on the second question, the policy makers, you know, one way is to convert the impacts into health that will work some time, convert it into money, and make them responsible for the future, because this is really happening. We are not just anticipating that it will happen. For those countries where the public takes decision, inform the public, you know, raise the awareness of the public.
Thank you. Any other questions?
Nino, can I add to
Sorry,
Dr.
thanks.
Mazen's?
Regarding the climate resilience, I just want to emphasize the situation related with the multisectorial integration, also with the role of the community. Even the team group about the implementation and the monitoring of the action to get a success on the method. There is my question, my daughter, if you have some a situation or decision to solve this goal. Thanks.
So the question was about the community engagement and how to improve that. Sorry, I missed.
Integration team.
Sorry, the mic probably.
The multisectorial integration team. And suppose when the implementation action is on course, the monitoring group to follow up to get the sources of the actions.
Who wants to take that?
I can take it.
Sorry?
I can take it.
I didn't hear you, Mazen. What?
I can take it if nobody will take it.
Yes, sure. Go ahead.
One way of approaching it is to make sure that it's a win-win situation for all the sectors. And I think just to demonstrate on this, we had a couple of years ago a co-benefit, health and economic co-benefits of being ambitious in meeting the NDCs in Pakistan. And it was actually the Ministry of Energy, the Ministry of Health, the population, the finance, almost all the governmental sectors. And through science, we showed what is the value, for instance, of shifting from Euro 4 to Euro 6 fuel in the country. And we sort of estimated that how many deaths will be saved, how many lives will be saved, and what is the economical value of this. What does it mean in health and financial terms to remove the subsidy from fossil fuel, for instance? We developed a certain technique, and that involved all the sectors. Involving the sectors in the policy is one way of doing it. And ultimately, we had a committee of more than 30 sort of experts representing all the sectors, talking almost the same language.
Thank you, Mazen. You had one last comment, and we need to close to...
Just to add to Dr. Mazen's comment, even when win-win solutions might not be optimal, I think at a minimum, we need to appreciate some of the trade-offs and understanding through the systems-based approach, climate and health interconnections. So understanding trade-offs can help policymakers prioritize the policy options they have in front of them. And in doing that, at the very least at the outset, we could prepare for those unintended consequences that policymakers do not like to be blamed for. So some of this, I think, can be addressed through implementation research. I'm so glad to see that Wellcome Trust is already investing in implementation research, because we really do need to understand what is happening on the ground. Is it the actual design of the interventions or something else on the ground, the governance, that is enabling or disabling their being effective? So more investment in implementation research and understanding why interventions work or don't work is really, really important. So the more of a shift we can put into applied research and implementation research specifically, I think is a good trend right now.
Thank you. Well, thank you so much, Mazen, Montira, Ahmed. Thanks for sharing your thoughts, and let's give those wonderful panelists a round of applause. And on to the next.